Mary, you have some special news to share about our CT project in the Almonte General Hospital. What can you share with our donors today?
Last week, I took a recommendation to the board to purchase the GE Revolution Ascend CT scanner for our hospital. The board approved it, and we are going ahead to acquire. The machine itself is state-of-the-art and uses artificial intelligence in a number of ways that are really going to benefit our patients. The equipment will help the radiologists assess each patient's condition and make sure that the most urgent cases are seen first. It will, when the patient is in the machine, automatically position the patient at the best point inside the machine to get the best possible image with the least amount of interference. It will use the patient's clinical information to make sure that the best protocol is used in capturing the image, and it will also automate a lot of the repetitive tasks that a technologist has to do behind the scenes. All of these things will give better image quality for the radiologists to inform the physicians who are making a diagnosis. It will result in a lower dose of radiation, which is safer for our patients, and it will also help us to use the machine really, really efficiently so that we can see more people in the time that the machine is available and running. There is also, as part of our package with GE, significant education for our staff, which will benefit them in getting up and running with the equipment, but also then as time goes forward. There is an excellent local service team locally, and the overall product package was one that we found very, very attractive. So there are some things we still need to do. As part of the RFP process, we asked the vendors to give us what we call a turnkey solution, which means that they are going to take care of the renovation to create the space for the CT scan, as well as supplying and installing the equipment. We then will have the renovation begin in our diagnostic imaging department, but in order to do that, we also need to move ultrasound to another part of the ground floor of the hospital, so we've got some renovation to do ourselves in order to make that happen. Once the renovations are complete, the equipment can be brought to Almonte and installed. So we will need to hire staff with expertise in CT scanning. We have a couple of part-time people now with some expertise. We'll need a full-time CT technologist to come and work with us. If everything goes the way we hope it will, I would say late spring or early summer of 2024. Well, we would not be buying the CT scanner without the community. The hospital relies on generous donors for 100% of the money that is required to purchase equipment for patient care. And the donors to the Almonte General Hospital Foundation have given money to the CT scan campaign, and it is their funds that will be used to buy the equipment and make the renovations that are required in order for that equipment to be installed.